90s.
Okay.
It was a very, very, very difficult task. So looking after all these things, we were like on foot every day. We were like on foot, either for blood or for a doctor, to in search of a doctor whom our children are being taken care by. So there were no hospitals also. So we
Okay.
parents came together with doctors and philanthropists and formed an parents organization 1998.
Okay.
So till the duration 1988 till 98, it was a very tough time for all the thalassemics in AP.
Okay.
Then once we came as a parents, then we started propagating this disease, and with the doctors like Suman Jain and Dr. Krishna Kumari. So our lives became
Much more
comfortable.
easier.
I can say it is more comfortable. Our lives became comfortable. See, we need not go for blood for door to door, and we are getting information on phone calls. So that is what we like, parents like me. There are few more parents like me, but unfortunately I lost him last year. But we have 1,300 children. Our
True.
society is having 1,300 children. We are giving them free counseling, free consultation, and we are giving 30% subsidy in iron chelation drugs, medicines also. And there are lots more to do. Like as a parents, we wish we need our children to get a corporate facilities, which even needs funding for these children for the medicine subsidy and all. And the corporate, our children need a sophisticated thing for sophisticated treatment, I mean to say.
Absolutely.
So that our children in the mainstream of this world, my children also need to have the facilities, so that they can go to schools, colleges, they can they can do their higher educations, and we want our children to be in the mainstream. So that is a main dream. We are going towards that dream.
So disease should not be a barrier, or it should not restrict them from entering the
all these
world.
things. Yeah.
They should get all the facilities what a normal child gets.
Yeah, normal
So
child.
that awareness is very important
Very
among
important.
people, and also the parents whose children are suffering from this disease.
Yeah.
One thing I want to add here, these children are very intelligent.
Okay.
Only thing is that if we can manage these children till 20 years of age, they can become a chartered accountant.
Wonderful.
Many of them have become a chartered accountant, and they can do their own business. They can become a nurse, they can become a doctor. Many things. Nobody can prevent them because they are highly intelligent. Only thing is that we have to manage these children till 20 years of age by the way of giving blood transfusion and making the treatment available, drugs to remove extra iron, and the government, if they can come forward to subsidize the drug.
Absolutely.
And then they will be able to manage. And after 20 years, if they become a chartered accountant, they themselves can earn their
take care of
livelihood, and they can
themselves.
take
Absolutely.
care of themselves for their treatment part. So that is one of the thing. And another thing which I want attention here, this thalassemia and sickle cell anemia. People get confused,
Absolutely, that's the
People
question
get
I
confused
asked.
here. So thalassemia is a hemoglobinopathy where there is a defect in the formation of hemoglobin.
Okay.
Because there is a defect in the gene. And sickle cell anemia is the red cell structure problem, where there is only one amino acid gets substituted by another amino acid. Glutamic acid is replaced by valine, and which causes the red cell structure like a sickle.
Yeah, true.
The grass tool, cutting tool is there.
Absolutely.
So it is the shape like a
Sickle.
sickle. So that is the trouble here. It's a red cell structure abnormality. So that is the difference. But both are inherited by the parents only.
Okay.
So inheritance is the same. And the diagnosis also is the same by doing a blood test by HPLC method, which is called high pressure liquid chromatography. If we do this test, if in fetal hemoglobin will be more than 95% in thalassemia, and in sickle cell it will be HBS, which is called hemoglobin sickle. So that is the difference between these two disorders.
Doctor, you said once the child reaches 20 years of age, and once they start earning, they can take care of themselves. So could you tell us what exactly is the lifespan of a child who suffers from thalassemia?
Yes, it is a very good question. Thing is that when a child is born, and if you maintain, if the proper counseling is done for the parents, they have to maintain their hemoglobin level of their child 9.5 to 10 gram %, and serum ferritin, which is the test by which we measure how much iron overload is there. If they maintain serum ferritin level less than 2000 nanogram per ml, then your child is very much normal, and their lifespan is like you and me and
Any
other
person
in this world.
But usually, what is the lifespan?
If they can't maintain their lifespan, like they are getting blood, they're just giving blood, then their lifespan is around 10 to 12 years. If they don't maintain anything and all, without blood transfusion and all, their lifespan is 5 to 8 years. If they maintain good quality of life, it is 40 to 50 years. They can get married, they can have their own children, but they have to marry a very normal person.
Not a carrier.
Not a carrier and not a thalassemia major. Like how in HIV they promote HIV people can get married to a HIV person.
Okay.
Here it is very, very important. They can't get married to a carrier, they can't get married to a normal person. They have to marry a normal person, not thalassemia major.
Okay. So, is there any permanent cure for this disorder? And if so, what is it, and how can it be, brought among people that there is a permanent cure? So don't get panic, don't lose hopes. There's something in store for you. So how do you tell people about it?
There is a permanent cure for thalassemia, which is called bone marrow transplantation or bone marrow stem cell transplantation. And luckily for the parents of thalassemics, that facility, along with the collaboration with the Italian collaboration, we are having this facility in Hyderabad, going to be a facility in Hyderabad, which is going to be placed in Narayana Hridayalaya Hospital. And the cost of bone marrow transplantation is 10 lakhs rupees. And for that, only criteria is their HLA matched donor is required. HLA is a histocompatibility linked antigen test, which has to be totally matched with the donor and the recipient.
Okay.
And maximum times it get matched when they are having their own brother and sister.
So there's no possibility of an unrelated person. It has to be a related brother, uncle, aunt.
Yeah, but nowadays bone marrow registry things are coming up. The registry thing is in Bombay and also in Delhi.
What is registry thing?
Bone marrow, like I can get registered in the bone marrow
just
center.
Like any organ,
any other like blood group thing and
Okay.
all. So bone marrow registry is there, and we are trying to work along with them and all. If we can do HLA testing of our children who are suffering from thalassemics, and their HLA things, if we send it to that bone marrow registry, and if they can get a matched donor, then the problem can be solved.
Regardless of whether they are related
or not related.
Important is a donor and a recipient.
Should have a HLA matched.
Okay. So you said in India this problem is major. Thalassemia is, the question is, what is the magnitude of this disease in India?
Yeah.
And is it worldwide, and how is it mapped, or how is the entire chain is shown in respect to thalassemia?
I'm going to show the slide where it shows the thalassemia belt is there, and around 1 lakh children are born every year, and in India it is around 10 to 15,000 thalassemic children are born every year, which are added to this pool of thalassemics.
Okay.
So that is a big burden when there is not a facility, when the government